Welcome back on the AM show. We told you in the beginning that we have a conversation on childhood cancer. We know that more than 1,000 childhood cancer cases are recorded in Ghana annually, and there seems to be an increase in the rises in the cases and the cost of treatment in Ghana, and many patients cannot afford it. Let's delve into how some organizations are putting up a first Africa treatment center here in Ghana. I'm joined in the studio by Dr. Tanya Tribet, who's the president of Wish for Life Foundation. Good morning, Dr. Tribet.
Morning.
Welcome to the show.
Thank you.
So Wish for Life is a foundation primarily that takes care of childhood cancer, is it?
That's correct. That's correct.
Right. So let's begin the conversation. We know that about 1,200 cases of childhood cancer is recorded annually. What do you think is the reason, or what accounts for the increase in cases that we are seeing these days?
It's not clear, but globally the amount of children who are developing childhood cancer is increasing. There are many studies that are looking at environment and other causes. We do know that ultimately there's a genetic change that happens that causes many of the cancers to occur.
I had a chance to do a story about 2 months ago at Kolebu, I think the Rebecca Kufuor Gifek House,
Yes.
where it's a facility that houses children living with cancer and their parents. And
Yes.
one of the things that they talked about that was very touching was the cost implications of treating childhood cancer. And these parents have to stay with the children. It means that they can no longer go out and find means of living, funding their lives and all that. So let's talk about the cost of treatment of childhood cancers.
Yeah, so the medicines that are used are well known, that are very effective. So the most important thing to know is that childhood cancer is curable. In the United States, 80 to 85% of children are cured of many of the childhood cancers. And what we now have to tackle is making that treatment accessible. The medicines themselves are expensive. And so obviously—
How expensive would you say?
It depends on where you're from. Where I'm from, it's quite expensive. Here, the numbers that have been estimated are right around $9,400 equivalent, which is expensive. So one of the things that I think will be important is that the global community needs to unite to help to take some of the burden away from families. Oftentimes for parents, this means one parent has to stop working to take care of the child. So the income of the family is cut in half. And so to cover the cost of care, then to cover the cost of lodging, food and other needs, then it becomes very prohibitive.
So in Ghana, for instance, how much does an average person need? You said $9,000 to $10,000 in the US. Here in Ghana, do you know how much it costs to treat cancer?
That's an aggregate, you know. So when we look at other places in the world where I practice, it's much higher than that. So it's close to about $100,000 US to beginning. There is not a way to reduce the cost of care because the medicines themselves have a certain markup. The advantages that you have here in Ghana is that many of the medicines come from Europe. The prices are lower, so they're subsidized. And there are compassionate components of each of the pharmaceutical industries programs that allow now for medicines to be more accessible and to be offered at a lower rate.
That's good to know. So let's talk about the facility that you are rebuilding.
Yeah, so we're starting to build.
So,
Yes. So we're planning.
So just tell us more about that.
Sure, I'd love to do that. We are building a 100-bed hospital that will be only for children who have cancer.
100-bed facility.
100 bed, yes, and there'll be residential facilities on the property. So approximately about 180 residential facilities, also for children who are going through outpatient care. And so the plan is to make those rooms available for children in Ghana and also children from the ECOWAS nations.
Where would this facility be situated?
So it's just north and east of Chebbi, so it's in Asakam. So it's between Kumasi and Accra.
Is it just a housing facility for children with cancer, or it comes with a hospital and hospital?
So the hospital is the key component. So the hospital will be a 100-bed hospital, cancer center, and then surrounding will be residential facilities. We talked about one of the economic challenges that's experienced. Many children have to travel with their families longer distances to be able to receive this type of care. So we know that there needs to be lodging close to the hospital that makes it easier for families to be able to reside close to the place where the treatment is being delivered.
100 bed facility is a big facility. How are you funding this?
So it's all privately donated. We have donors from the United States who are giving support for this. And then we're beginning to open a campaign, which we talked about in October here, that's called the Voices for Life campaign. It's a global campaign to help to support children who need the therapy the most in developing nations. And so one of the places that we've chosen first is here. Okay. So we're looking to galvanize the global community to help us to fundraise to be able to support the initiative here.
It's a great initiative. How different would this be from the other facilities or hospitals that we already know exist?
Well, you have excellent facilities here. What we're looking is to be able to provide care to more of those children that are not having access to care. So it's not to be competitive, but to be able to provide the resources that are necessary. What may be different is the type of tools that we use for diagnosis. So we're looking to bring a type of imaging that's very important in cancer now called positron emission tomography. So it's PET scanning, which will help us to better detect the cancer within the body. And it will also allow us, through the course of treatment, to know that our medicines are working more effectively.
Right.
So this is one of the areas that we're really excited about bringing that's brand new to the country. In addition, we'll begin to expand the number of medicines that we know is effective and works, for children with their cancer.
So how much will people be required to pay for this, or would the cost be subsidized as well?
So what we're looking at is subsidizing strategies to subsidize the cost. Obviously, Ghana is very progressive in that they have included childhood cancer now in the National Health Insurance Scheme, which is a major step forward. We know that there may be other needs that may require additional funding, and so we're looking to subsidize that through endowment funds as well to support the needs of children.
Okay, we know that early detection is primary, pivotal in the treatment of cancer. So aside building this facility, do you have any plans of increasing awareness, sensitizing? Tell me a little bit more about
so we're already starting the process by giving shows much like what you have, and then more focus shows on television and radio and in the newspaper, segments that give more awareness. And we know that early detection, the earlier detect the cancer, the higher the chance of cure. Right. So we'll begin to implement, as we begin to build, at the same time, a variety of ways that we will access the media to be able to educate the public about childhood cancer.
You talked about global community and collaborations. What about the government of Ghana? Do you have any sort of partnership with them or anything? Are they offering some sort of support? Anything in the works?
So the good part is that we're co-creating together.
Okay.
So there are many divisions that we're working with right now that are important stakeholders. Okay. The plan is for the hospital to be run by the citizens of Ghana. Okay. So I won't be the chairman of the hospital, but we'll certainly help to shepherd and make sure everything gets done. But already we're working with multiple teams to make this happen, and they've been fantastic. So
which means your nurses and doctors and workers will be here from Ghana.
That's right, that's the plan.
Okay.
And then also we're working with the agencies to begin to build out the network. So we're visiting this time to begin to start the steps of building an information technology network that will support the hospital. That takes a little bit longer than building the hospital.
I know you are doing this out of the goodness of your heart, and the children who come to your facility will be blessed to have such a place to go to for treatment. What is the overall intention you hope to achieve at the end of this?
I've been fortunate now for 30 years to take care of thousands of children, many of which who are alive now and have their own children and families. Yeah. So the fulfillment for me is seeing the person leave the cancer behind. So I always tell my children, Cancer can just become a page in a book of your life, and that's our goal, not to become your entire life story. And so what I want to see is that same opportunity be present for children here, to know that they have the same access to care. Yeah. There's no difference by where you live or who you are, the color of your skin, that you should be able to have the same quality of care. And also for the parents to have that same hope. And not only hope, but to see the actualization of their dream for their child to be returned to health again and not to worry about the cancer.
Which means while your children are receiving cancer treatment, you can also go about your life, work and trying to make ends meet so that you can again support your children. Right. Thank you so much, Dr. Tribbitt. Any final words before we wrap this up?
What I would say to the parents who are suffering with their child, don't give up hope, continue to fight, and we will look for a promise for you for tomorrow that your child will get better. So thank you very much.
Thank you so much. That is Dr. Tanya Tribbitt, President of Wish for Life Foundation. We're building a treatment center here in Ghana for children with cancer. Thank you so much.
Thank you. It's a pleasure.
Yes. Stay with us. Up next, we're going to talk about the Right to Information Bill. We know that the submission of annual reports by public institutions is a mandatory activity to be performed by all public institutions. We'll be joined by the RTI Commission to discuss the nuances of this bill and how to effectively implement it. Stay with us.